I'm going to tell you what you're feeling and how you're doing, and I'll give you some tips along the way.
Okay.
All right, go ahead. All right. So Mariah here is at the end of her rotation, so we're going to do a little learning and see what she knows how to do. Go ahead.
All right. So I'm going to feel.
Remember, always start up here. Yep, start at your thoracic, feel down to the lumbar, and then you could feel at those iliac crests.
Okay. Working and observing. Feeling for any tension. You're so relaxed.
Did you feel anything in the upper thoracic? Go back up. Stop. Feel the difference on right to left. Do you feel that difference right there?
This side feels tighter.
Good. Okay, keep going.
This side feels tighter. This is right.
See, it helps to do it on me because I'm really in tune and I know what you're feeling.
Yeah.
Feel that on the left side?
Yeah, this
Perfect.
left side feels tighter.
Not much. I am decently relaxed, but that's like if I also do yoga twice a week and come home. All right, now you can find the iliac crest.
All right, iliac crest. Okay, I feel it here.
Okay, all right, now I'm going to bend forward. So I would say let your thumbs be a little bit looser.
Okay.
That's too tight because you want your thumbs to be able to move in case anything's going on. So a little looser than that. Just let them kind of just sit there.
Okay.
All right.
Oh, I see it.
Was it on your left
I
side?
can't tell if it's, no, it was my right. So I can't tell if it was the dress or me.
Okay, try that again. Okay, ready?
Okay.
Anything?
I still feel like it's my right.
And it might be.
Okay.
I only say that because if you look at my feet, they're not even, and it's just I'm just standing that way.
Yeah.
I'm not purposely doing that. So you can go ahead and check out my hips. So all the way down, and then you can check out my hips. Wait, you said it was on my right side?
Yes.
It's on my right side.
Okay. Felt like it was on the right.
So see if you feel any difference in the ASIS.
This one feels higher.
Okay, so this is your problem side, right? This is where you feel to go higher. So the problem is this side is inferior. So what treatment do we do on this side?
This is inferior.
Yeah.
Okay. So because this side is inferior, you're gonna come out of here.
It's gonna come up towards me. So put your hand under at L5. Okay, good. And so you're gonna bring up until you feel like it's hard under your hand.
Okay.
So you feel that? Good.
Yes.
And now I'm gonna try and push against you.
you.
Good. And then you're gonna bring it towards me again. Good. Good.
Then
One more. Okay. Good. And then bring me back to neutral. Good.
until you get
And then you're gonna check both sides again, and you're gonna see, does that still feel superior to you?
No, they feel equal.
All right, there, feel that bony prominence right there?
Yes.
Yeah.
They look equal.
Good. So what I bet you can feel is my neck. So come around and sit back here. So I want you to feel on my suboccipitals. You've only seen me do this a couple times, but it's something that you can learn to do
Okay.
that's easy for you to do on patients.
Okay.
Because Mariah here wants to do family medicine, so she'll be able to practice some of these. Okay, so go ahead and just feel my neck. So how I normally feel patients' necks.
Okay.
So I check
Usually
rotation,
go
side
there.
bending. Yep.
Okay. Rotation feels good.
Okay.
Well, going to this side felt a little tougher.
Okay.
Okay.
Now check inside bending. Good. And
Yeah, this side.
both sides feel okay. So your side bending and rotations is harder on this side.
Okay.
So when you go through and you feel the cervical muscles on either side, you're gonna probably feel there's something on this side compared to your left side.
They usually go under head.
Mm-hmm.
You feel.
So what I feel when I'm in the cervical, what I do is translation. So like, I usually have both my hands. Let me see this hand and this hand. So, like what I'm doing is moving, kind of like this. So like, can you feel the movement this side
Yes.
compared to this side?
Yes.
Do you feel how that's restricted on this side? That's what you're feeling.
Oh,
So like
okay.
that's
I feel it.
that's where the issue. Like you're going down the whole neck and feeling where the issue is.
Okay. Yeah, I feel it.
Okay. So walk back up to my suboccipitals and see if those feel a little bit tight right there.
This one.
Yeah. So what you can do, so I'm gonna bring my head off the table
Okay.
and you're gonna take your fingers and you're kinda gonna cup up and you're going to, and you can just do it on this side, and you're gonna bring it up and towards you. So like it's like in this motion, yeah. And I just let my head relax back.
Oh, like a cervical pressure point.
Pretty much.
Okay.
But you're doing like pushing up and pulling towards you, and then like when it starts to, you'll feel it relax, and you can keep going, and you'll eventually feel it relax and compare to the left side.
Feels relaxed.
Use your fingers on the left side and feel the difference in tension on right versus left, because right is definitely more.
Yeah. Okay.
Yeah, it doesn't help that I'm holding my neck up.
No.
Here, and relax.
Okay, I feel it. I feel it
Okay.
now.
So then you don't even need to put pressure on the left side, you're just putting pressure on the right side until you feel a relaxation compared to the left.
Okay, it feels relaxed.
Okay. So then come back down to where you found that spot in the neck.
Okay.
So, right here. So what you usually see me do is muscle energy.
Mm-hmm.
So what I do is I take the patient and I turn them to the side that's the problem,
Okay.
and I rotate them to that side. So I take them to their barrier point. So go ahead and try and find my barrier point. So you're gonna turn me, keep your fingers on that segment right there.
Okay.
So here, keep it on that segment. And where do you feel it kind of get hard under your hand?
Right here.
Right there's my barrier point, good. And then you try and engage a little bit. Usually I do side bending first and then I do rotations, but it's fine.
Okay.
So now what I'm gonna do, you're gonna keep your fingers there and I'm gonna try and push to my left as you resist, okay? And you can feel it under your hands, right? Good. So now you're gonna take up the slack, so meaning you're gonna take me more into my barrier point. So to the next barrier point, right there. Good. And I'm gonna turn. Good. Good. Okay.
So let's try to go more.
One more. Good. Now take me back to neutral. And then you're gonna compare and feel that again.
Directions to where?
Directions to where? We're doing cervical things.
I don't know.
So go ahead and
Where would you like to go?
So you're gonna go ahead and feel my neck again and see if that feels better to you.
Ooh, yeah. It feels way better.
Good.
They feel equal.
Mm-hmm.
Yeah.
So I want you to keep your hand here. So when I'm doing, move this hand. So when I'm doing a cervical like traction pop, and I can do this on myself, don't do this, but like I'm just doing one segment. So you felt that was just in one little area.
Okay.
Versus a lot of chiropractic, it's the whole neck. That's not what I'm trying to do. But
Okay.
if there's a segment that still feels stuck like it did there, so now compare that and see how that feels. So that was me just opening that one tiny segment.
Oh yeah.
So I know how to do that on myself.
Yeah. It
Don't do that at home.
It sounded crazy.
So it's very specific, and I'm feeling very specific segments when I'm doing that.
Okay.
But it can make a big difference when I can't get a certain segment in the neck to be back to where it's supposed to be.
Okay.
Okay, so I'm gonna have you try some muscle energy on my low back, because you did that on someone today, and I want to feel what your pressure feels like. Okay.
So we said we had tightness here,
Mm-hmm.
and then we had tightness.
Yeah, go ahead and feel the lumbar.
Okay. Lumbar.
Does one side feel worse than the other?
Yeah, it was this side.
Okay. So try some myofascial release in there.
Okay.
So I will. So you're just gonna do straight downward pressure. You don't even gotta move.
Okay.
Just like that. That's good pressure. And you literally just hold there.
Okay.
And you see how that deep breath helps?
Yeah. Yeah.
Good.
Oh, they feel the same.
Okay.
That's crazy. Okay. So, and then we had thoracic here. Here's here.
Mm-hmm.
Then take a deep breath. And again.
See, I don't do a lot of myofascial in there.
Oh, really?
Mm-mm.
Is it because it hurt because the ribs?
It part of the reason.
Okay.
Yeah. Go ahead and stop recording medicine.